Well, let's go ahead and just get started as people are possibly trying to log in and connect with us on Zoom. My name is Mary Messier, and I think you saw in some of the videos that you saw that we're collaborating with several partners today and working towards the goal of decreasing, raising awareness of prediabetes and trying to get the message out about the prediabetes epidemic in Shasta County. And know there's things they can do and resources that we have available to them. So I'd like to know, I don't know if anyone else has joined us yet on the Zoom piece.
Mary, I have some people texting me that they have joined the program.
Okay.
I don't know if they were able to transition into the Zoom like we did.
Maybe the link for Zoom, because I don't know if anybody else is on here.
How do they join? How did the visitors, those participated, join the Zoom?
I think they said there was going to be a link that came right after OV.
Oh, okay. I lost them. I'm asking, I'm texting them. Get link to join Zoom to ask questions.
Let me see if we should put the link. I don't know.
Please check.
Rob, are you still on?
Like.
I don't, let's see. Only the panelists are on Zoom. You're live, but no one has asked a question. Okay.
No, I don't think they know that they have to. No, he says that he didn't get any link to join the Zoom.
Okay.
That's why nobody is there. I sent this question. Did you get link to join Zoom to ask questions? Please check. He said no.
Okay. So maybe through OV, I'll tell him that he needs to send.
Oh, they can hear me on the OV? But on the Zoom, there is nobody is able to see on the Zoom and see the video.
Yeah, I'm
so you're able to see me talking on the phone?
So are we on?
Oh.
Okay, so can people?
Okay, that's. Because some think that they are able to see me hear me on the OV without joining the Zoom.
Okay. All right. So I haven't received questions. So I mean, we can maybe just start. I mean, if people are able to hear you at least, we could start with, I could ask a couple of questions until I see some questions sent to me that people have asked. I think Rob was going to send me some questions. So I'll start if people can hear you. A question that I have is, why should we be concerned about prediabetes when you don't actually have diabetes?
Yeah. So yeah, I'll answer that question. And I just want to say, some of the participants texting that, can you send us a link for Zoom? Is there a separate link for the Zoom? They can hear and see?
Yeah.
There, I got a message saying, can you send us the link for Zoom?
Let's see. They don't link to Zoom. We are only
panelists are on Zoom. Oh, okay. So, but they are able to see
hear us.
the OV. Oh, okay.
I think they can hear us.
Oh, okay. So
Okay.
Very good question. So diabetes, when people develop diabetes, it's hidden and invisible. They don't have symptoms. They have had diabetes for a long time, and many times they have complications like affecting the limbs, the kidneys, the blindness, or heart disease and stroke. So, before developing diabetes, they had a long period of pre-diabetes where their sugars were higher than normal, but not high enough to diagnose diabetes. That presents the golden opportunity to prevent or delay diabetes. We see most patients with diabetes with complications where there is no way to reverse those complications. They have to suffer those complications. So, people at high risk and anybody at the age of 45, anybody with relatives, anybody who's overweight, if they know that they have a risk for diabetes, if they test it and if they get treated, then they don't progress to the stage where there is no treatment but just suffer. So pre-diabetes, identifying and early intervention leads to delay or prevention of diabetes and provides the best opportunity to prevent diabetes, to prevent suffering from it, and prevent a lot of expenditure for the healthcare.
So by working on lifestyle changes early on, you could actually prevent or delay type 2 diabetes.
Yes. So there have been impressive studies where within 3 years there was 58% reduction in the diabetes prevention study, and there was about 48% in 23 years in another study, and an outcome study that showed 20% reduction. Just by these lifestyle interventions, nutrition, proper diet, exercise, weight loss presents a great opportunity to prevent the suffering and complications.
I also think it's worth noting here that most cases of prediabetes, if left untreated, will develop to diabetes within 5 years. Is that correct?
Yes. So there are about, 1/3 of the US population, and when it's come to Shasta County, 50% of the adults have prediabetes, and every year about 5 to 10% of them progress to diabetes.
So if we were to share what actually is prediabetes, how, because I think everybody has more of an idea of what diabetes is, but how would we define prediabetes? What is that? I think it's a newer term to people.
Yes. Yeah. So the prediabetes is the condition where, as the name indicates, it's a precursor to diabetes, and there are risk factors. And the prediabetes has the same heightened risk for heart disease. Vascular disease, which includes strokes, heart attacks, and peripheral arterial disease leading to amputations, and the visual problems leading to blindness, the retinopathy due to vascular features. So all those can be delayed and prevented by treating prediabetes, which is a condition where sugars are higher than normal, but not high enough to diagnose diabetes. So for a long time, they have been ignored and not intervened. Now we have a lot of data, a lot of facilities to identify them and intervene in that stage so that they don't proceed to the stage of diabetes. So their sugars are higher than normal, they're not high enough to diagnose diabetes, and they don't have any symptoms. That's in a nutshell what is prediabetes.
I think that's a really good point. I think possibly we weren't even really aware screening or looking at the prediabetes as much, and now there's been a little bit of more of an awareness with providers too, to kind of look before somebody's actually diagnosed with diabetes, because there's changes that can be made to prevent or delay from developing diabetes. I do have a question from Heidi. Will I stay a type 2 diabetic if my next A1C numbers are good?
That's a very good question. Once you're diagnosed with diabetes type 2, you have diabetes. Then if you bring it down, then your diabetes is under control. So you're a controlled diabetes. So the pre-diabetes is an A1C of 5.7 to 6.4. 6.5 is diabetes. So suppose we have a patient whose A1C is 7. If we control it, it drops to 6. That is pre-diabetic range. What it means is they have a good control of diabetes. Some people even drop it to 5.6, which is even lower than prediabetes or the normal range. What it means is not to stop what we are doing or taking medications and get back to high sugars and complications. That's a good thing if it goes to normal or pre-diabetic range. It only emphasizes that you are very successful in controlling your diabetes and preventing complications.
Great. That's really important to hear. Are there any more questions from anybody out there? Rob, I don't know, because I'll wait until we see more questions come in, but until then, we can keep the conversation going. Why do you think that there are more people developing prediabetes and diabetes?
So over a period of time, our lifestyles have changed. The availability of high calorie, high fat foods, the expense of more nutritious but less calorie foods, sedentary lifestyle, all the facilities and things that come with civilization, that if we go back and look at it, what do we do for pre-diabetes and diabetes is we're talking about exercise, nutrition, and weight loss. These were part of the life before the advent of these excellent cars, apps, work that doesn't require manual labor. And so it's a combination of these things that globally there is almost an increase of diabetes of epidemic proportions. And it is a global phenomenon, whether it is in the developing countries like India, the growth of the prevalence of diabetes is increasing, and so is in developing countries, but it is leveling off. Like there has been a 382% increase between 1988 and 2014, but that rapid, steep increase seems to be leveling off, but that's no reason for complacency. And it is only reason to even sharpen our skills for early recognition, intervention of prediabetes. And fortunately, in the last few years, we have a great revolution in therapeutics too that is helping take care of diabetics.
Thank you. We do have another question from Charles. Will diabetic neuropathy go away since his numbers are under control? So will diabetic neuropathy go away since his numbers are under control?
So that's an excellent question. That's how we came to know the importance of bringing down the A1C. If the A1C is kept under good control, then neuropathy will not develop or will be delayed. But if patient already developed neuropathy, still the progression will be less and there will be a slow improvement even after they develop neuropathy. One point I wish to raise here is sometimes when people get this tingling, numbness, burning sensation of the feet, which is called neuropathy, which people recognize as neuropathy. In majority of cases, it is neuropathy, but the sugars are high. Even before developing neuropathy, they have this glucose toxicity that leads to some of those symptoms, including visual impairment. Those are completely reversible if the sugar control is improved and maintained. That's the thing. Sugar control should be improved and maintained, and leads to improvement of those or disappearance of symptoms of glucose toxicity.
So really good point, no matter where you're at, if you're somebody who's pre-diabetic, there's lifestyle changes, there's things that you can do with diet and exercise to prevent or delay type 2 diabetes. If you have already been experiencing some of the symptoms of diabetes and you are diabetic, still making those lifestyle changes and with diet and exercise and potentially at that point medications, but all those pieces are still play an important role in helping for things like diabetic neuropathy.
Yes.
Thank you. Until I see some more questions coming in, I'll continue to ask some questions. And Pauline, if you have any other questions also, I think we may have talked about this a little bit, I know in your talk too, but can you actually, so would you say that you can actually prevent diabetes by changing how you eat or exercising more, or is it more than that?
I'm going to say from my standpoint with the diabetes prevention program, our goal is to reduce your risk of developing diabetes. I can't guarantee that you're not going to develop diabetes. And I think Dr. Kumar can talk more about that. There's genetics and lots of other factors there. But by changing your lifestyle when you're pre-diabetic, you are delaying the onset and potentially preventing diabetes. So, you know, I'm not going to tell you 100% that that is the case, but we will delay the onset or prevent. And Dr. Kumar, you may want to add to that.
So can you please repeat the question?
So I was saying, can you actually prevent diabetes by changing how you eat or by exercising more? Or is it more?
Yes. We don't have exact number that how much we can prevent. Definitely it delays and prevents by lifestyle. If you find it in early stages, including early diabetes, all these measures will lead to delay or prevention. And Pauline raised an important thing that we can guarantee that we will prevent in everybody who does this rigorously. Some of them will progress to type 2 diabetics, but they will be in an excellent condition for good control.
Great. Thank you so much. We do have another question. Why is there a rise in type 1 diabetes?
Yeah, so the type 1 diabetes is not rising that much. It's mostly the type 2 diabetes.
Okay.
Type 1 diabetes is the diabetes that happens in children. Although the common thing for type 1 and type 2 is the raised blood sugar and the complications, the way it happens is completely different between type 1 and type 2. In type 1, it happens in majority of cases in children where there is an absolute deficiency of insulin because the cells that produce the insulin are destroyed by autoimmune process, whereas type 2 is due to multiple reasons, including genetics, the lifestyle, the food, the weight gain, and a combination of things. And it is the type 2 that is really experiencing a rapid rise.
Thank you. So what would you say if you were to summarize the main things that people can do now to, if they are either pre-diabetic or they're concerned, what are the main things they could do to prevent or delay diabetes? What would be important?
So anybody who falls in these categories, anybody is above 45 years of age, or anybody who is younger but whose body mass index is more than 25 and has somebody who is a first degree relative that has diabetes or stroke, heart attack, they are at a higher risk for developing prediabetes. So all of them should get tested early, and they should follow the nutrition, weight loss, and exercise. If they are in pre-diabetes range, they should follow. But the very fact that even if they test, they are not in the pre-diabetic range, it raises the acuity that, hey, I'm close to that. I'm one of those who may be developing. And if by doing this, I will delay the pre-diabetes and eventually the development of diabetes type 2.
So I have another question from Lori. I will always be considered a diabetic, even though I dropped my A1C from 6.3 to 5.9. Do I need to continue to take metformin?
Yes. So it's a good thing that the A1C dropped. The key factor now is how do you maintain that? If you continue to follow the weight loss, the dietary measures, and exercise, you also don't have any risk factors or current heart disease or stroke, then the physician can try to cut down the dose, but metformin is good to continue under those circumstances and have a close follow-up and probably reduce the dose. So whoever developed type 2 diabetes, they have that system within them regarding insulin deficiency or mostly resistance and their genetic makeup. So it's a great thing that the A1C has come down, but they are the ones who really can prevent any of the complications by maintaining it like that. And it also depends on the age. If somebody is really elderly and their A1C has dropped from 6 point to 5.9, may not be necessary. On the other hand, if you have a 50-year-old who has a little bit of heart disease, and then we have to do everything to prevent a heart attack, a heart failure, or a stroke. So this number 5.976 is not a fixed number. It has to be tailored depending on each individual, and then a discussion with the physician as to what is the risk and what can be done best is important. So I have a 45-year-old teacher whose A1C is 6.3 and did well to decrease, and his mother had a heart disease early. Yes, I will continue this medication and even add something to keep him that way. On the other hand, I have a 84-year-old who just followed the diet and took one metformin and came down. I would consider taking him off the medication.
Thank you. So it's really something to discuss with your personal doctor and under your own circumstances, how things might be controlled or changed.
Yes, set individualized goals of A1C.
Thank you. I have another question from Heidi. I hear sugar alcohols are as bad as regular sugar. At what point do we need to be concerned about those in our food?
That's another important question. Yeah, 1 or 2 drinks of alcohol are okay if it falls within your calorie requirement and the goal for weight loss. So when we talk, alcohol doesn't have to be stopped completely. 1 or 2 drinks are fine in moderation, and they don't. And the only question, like Heidi raised, is overconsumption or alcohol taking the place of a nutritious meal should not happen. Since Heidi raised the question of alcohol, I just want to mention about smoking. Smoking is bad and all attempts should be made for smoking cessation.
Thank you. And I think that's some really good information about alcohol. I may not have asked the question clearly. She was asking about sugar alcohol, so I'm assuming she's talking about things such as sorbitol, xylitol, that type of sugar alcohols. Those type of sugar substitutes, I guess would be another word we could use. Do you feel that some of those sugar substitutes like sorbitol or saccharin or different sugar substitutes like that are as bad as regular sugar? At what point do we need to be concerned about those in our food? Because oftentimes I think, just to expand on that, possibly a lot of people that are concerned about diabetes might be using sugar substitutes instead of sugar. What should we be thinking about using sugar substitutes in our diet?
Yeah, what is your idea on that, Mary? You're really good to answer that question, being a nutritionist.
I think there can be a place for sugar substitutes, but it's not. I think we look better at the overall diet, and I think that's what a lot of these lifestyle change programs try to do. I don't think I think a lot of times we can just use sugar substitutes and think that if we're replacing our sugar with that's healthier, but it isn't normally. It's really looking at that whole, what a lot of these diabetes prevention lifestyle change programs are doing, looking at your whole diet, looking at the healthy diet, the fruits and vegetables, whole grains, meats, what's the overall of your diet, and not really, when you're following that type of healthy diet, you don't really need to have sugar substitutes as a part of that. They're not something we need to really be including in our diet, and it's not making our diet any healthier to include those types of products into our diet. It's just looking at your overall healthier diet. And Pauline, you can share a little bit more. I don't know if you talk about that at all in the diabetes prevention program, that especially for people that are pre-diabetic and are making all these lifestyle changes, using sugar substitutes is normally not really necessary or included.
Yeah, I would just, reflect on what you said. I think what we're really talking about is making the lifestyle changes to just kind of retrain yourself to eat less sugar in general, those kind of things. But you're right, there's a time and a place for those substitutes, but that's the kind of thing we talk about. And I think you made the point, which is we're looking at an overall big picture here. We're looking at your daily consumption of things, and not just one or two things here and there. So we really try to take that big picture look and try to balance, right? And balance our lifestyle and balance our eating and that kind of thing. And those are the things we talk about in the program. And we count fats, or we might count calories, that kind of thing. But I will say we do not count sugars in our program. We really focus on fats, because these people are in the pre-diabetic range. They're not diabetic yet.
Yeah, it really is that overall healthier lifestyle. I do have another question for Dr. Kumar. Are there any new medications that I could use to help manage my diabetes?
Yes, I'm just typing that. That's my favorite question, and thank you for asking that, being a physician. And so as I saw that question, I brought a slide of a talk I gave recently to the residents. So previously, if somebody has type 1 diabetes, before discovery of insulin, that was like a death sentence. There was no treatment. So in 1922, Best and Banting got a Nobel Prize for discovery of insulin. Since then, it took another 30 years to find the next medication, which was like glyburide. Then it took another 20 years to find metformin. So from 1922 to 1995, we only had 3 or 4 medications. The last 10 years, especially the last 8 years, have seen almost a revolution in the management of diabetes. Previously, we used to treat diabetes with medications that would control the sugar, but increase the heart disease, increase the risk of low sugars, and increase weight gain. But now we have a whole new medications that not only bring down the sugars, but they reduce heart attacks, they reduce death from heart failure, they prevent strokes and amputations and kidney disease leading to diabetes. So we had 3 medications before. Now we have about 20 medications, and there are classes of medications that are easy to take, less side effects, less low sugars, less weight gain, and get results with respect to prevent complications like heart attacks, strokes, amputations, blindness, or dialysis. So so our goal is to prevent or delay diabetes and be in good condition. And when you have diabetes, to use the right kind of medications and not those older medicines that will really help improve the health and prevent death and complications. Thank you.
Thank you. So I'm going to ask a couple of questions while we're waiting for any other questions to come in that kind of relate to Carrie. I'm not sure if you're on. If she's not, Pauline, you could maybe answer for some of the people that have been part of the YMCA program. I know Carrie has been a lifestyle coach. Just wondering what that's like to be, I know you use lifestyle coaches as part of the YMCA diabetes prevention program. I was wondering, what is it like to be a lifestyle coach, and how did she get to being there and having that role?
I believe Carrie's on, but I'm not sure. So I'm going to give her a moment here.
Okay.
And I think I just answered the last question with my mute on, so I don't know that anything came across. Oh, sorry, people. So I'll go ahead and answer Carrie's question. So when we started the program at the YMCA, I basically reached out via, ads and various things looking for people who were interested in lifestyle coach. I actually happened to know Carrie we had kids that were in school together, and she just has the kind of personality that is very good for a lifestyle coach. I think one of the things that makes a successful lifestyle coach is that they're not teaching you, but they're encouraging group discussion. And that is what this program is about. It's not about us telling you what to do. It's about you figuring out what works for you, because that's what's going to stick for you. So we might be in a small group and we're talking with each other, but what we're realizing is that this is what works for me and this is what works for you, but we share ideas and we develop bonds and we develop, we learn from each other and that kind of thing. But this is not about us telling you, here's what you're going to eat for breakfast, here's what you're going to eat for lunch, and here's what you're going to eat for dinner, because most people aren't going to stick to that for a lifetime. So what we try to do is give you the tools that you need to be able to make the adjustments to your own lifestyle so that you can stick to them and live with them for, on to eternity after we're done with the 1 year long program. So that's what that lifestyle coach does. She doesn't teach you, she works with you to figure out what is going to be successful for you as an individual. So I think that's what makes a good lifestyle coach, and that's what Carrie's been really, really good at.
And it's lifestyle coaches that facilitate the sessions.
Ah, there's Carrie. She just showed up. Yeah. I don't think you're muted.
Sure, I unmute Carrie.
There we go. Here we go.
Go ahead, Carrie, if you would like to. Would you like to answer that in any way you're?
I actually thought
the question?
Excellent. I think Pauline did an excellent job answering that question. I've been typing away at all the answers as much as I can. I have been a lifestyle coach now for 2 years with the YMCA, and super success rate with a lot of the participants we've had. So yeah, I'm really proud of everybody, and I really enjoy the classes. It's really encouraged me and changed a lot of people just by giving them all the education and supporting them. The group actually is significant to getting the support that's needed too. You start to realize that you're not an individual. There are so many others that are going through the exact same thing. So that kind of support is extremely helpful in the group individually too. And I mean, just with the stresses of life right now and everything, just knowing that there's others out there, it's a great support system.
Great. Carrie, maybe since you're speaking right now, maybe you can share a little bit for just about some of your participants in the program, like how they came to be a part of the Lifestyle Change program. I know we got to hear some of their stories already about why and how they joined, but I don't know if maybe what was some of the favorite parts of for them being in the program, or some of the things they may have shared about what they enjoyed about being in the program, or how it helped them?
Sure, sure. I think definitely there's a lot of success rate that we've had, and I have particular participants that would say, you know, they not only were able to get after you know the end of the year, the whole program, but I have one participant that just puts in my mind. She called me to tell me she not only got down to the ground, but she got back up, and 97 pounds she lost, and you know, a year later she's able to hike and do a lot of things that she wasn't able to do before, including tying her shoes. So there were significant changes specifically to this one participant, excuse me. But I would also say sharing all the success stories, so each person, you know, brings to the table what they're going through. We had a significant year over a year ago when we started with like the snow and, you know, all the problems that we were having and the stress, you know, just to, I had participants that were, you know, years of things that were going on in our house flooding and stuff like that. But as a group, everybody was able to just come together and support each other and really learn from each other's stories too, the things that they were going through and what significantly could help each other. So the support of learning together too. Yeah, I hope that helps. But I would say also, most of the participants, I think, would probably give great feedback and look back at what they changed. And a lot of them are maintaining and striving to continue. So I have some participants that want to continue to lose some weight, and they're reinventing the wheel, like start the program over on their own now that they have that curriculum available to themselves. So it's pretty cool.
Great. So it sounds really like the support of the group is really a big piece of being able to make those changes and how you rely on each other. So that's a really exciting part of the lifestyle change program, and that you're with your peers and kind of working through things together and with each other. Dr. Kumar, was there anything else you wanted to share, Carrie, before
no, and I mean, definitely able to answer questions. But I think more than anything is reaching out to the YMCA and asking more questions if you have them will be super helpful, and see if we can get you qualified.
Great. Dr. Kumar, I know you've been answering several questions in the chat already. I don't know if there's any of those you wanted to come on and share with us too. I think people are getting it answered. I think that there's one really good question in there that I'm seeing saying I'm diabetic. What are the risks for my children?
Yeah.
I think if you'd like to answer that.
Diabetes is, yeah, the children of parents with type 2 diabetes at risk. And as we said, it also increases with age, and weight is another risk factor. So anybody whose parents are also diabetes should pay attention to getting tested a little bit early and periodically, like once in a year or two, even if all their sugars are good, and try to maintain a good ideal body weight and incorporate things like what can we do with diet, how can we improve our health by regular exercise, even in small amounts on a regular basis, and keep working at it will really make a big help in the progress.
So those lifestyle changes for our family members are important to start with children young. Eating healthy, being active is important for our kids as much as it is for us.
Right.
Let's see. And I think, Pauline, you were sharing some things because the question was that Dr. Kumar answered. One question was, where do you tell your patients to begin when it comes to lifestyle change what small steps can someone take to improve their health, considering how busy we can all get in our day-to-day life. And Dr. Kumar answered that, incorporating regular exercise, cutting down on sugars, increasing vegetables, improving diet. Pauline, maybe you can share a little bit more about some of the things that you learn or do in the diabetes prevention program at the Y.
Absolutely. I think, you know, what Dr. Kumar is saying sounds easy, right? Like we can all do those things. But over time, I mean, I think what happens with people in general, and I'm talking about myself here and everybody else, is that we get on a bandwagon and we're good for about a week or 2 weeks, or maybe even a month, or maybe even 2 months, but then we kind of slip back into our own habits. And the reason for that is that we haven't changed the underlying behaviors that are making those habits happen. And so in our lifestyle change program, we talk about those lifestyle triggers. You know, we talk about stress. We talk about what's happening in your life that makes you go to the fridge and, you know, eat that thing that you know you probably shouldn't eat. It's like we talk about these things and we come up with different tools and different ways to deal with the stress in our lives. And we work through it together as a group. And sometimes what works for somebody might work for me as well. So we get to share our successes and we share our you know, things that we're doing, and we just come up with new ways. And I think Lucinda in her testimonial kind of made a point of saying, you know, we're in this together, you know, and that's kind of how it works. And you're accountable to your friends in this group, and you just kind of have this way of sticking to it. And it's a year long for a reason, because it takes a long time for a habit to stick. And so when we're in this program for a year, they become just a way of life as opposed to a diet. I think Carrie would be the first one to say, she's always saying, this is not a diet. This is not a diet. We're changing your lifestyle. I've heard her say it over and over in class, you know, and I've also heard her say over and over in class, it took us a long time to get here. It's going to take us a long time to get out of it. So we're not, you know, when people are frustrated that something didn't change overnight, we're saying that's okay. It's not supposed to change overnight. You're supposed to make changes that are going to stick and that are going to stick with you forever. And so I think Lucinda and some of these other people are just really good examples of perseverance, and sticking with it gets results.
Yes, that's the key thing, persisting and doing in small steps. Yeah.
Yeah, and I think that's a really good point, that it does take us a long time, and we need to be patient with ourselves, give ourselves the time and the grace to make changes step by step. And I think that's the key with the lifestyle change program. You're doing it in a group with other peers that are going through the same thing, and you can talk about your challenges and discuss your struggles. There was another question, Dr. Kumar, that you answered, but I think it's a good one to talk about, from Charles. Has lost quite a bit of weight in the last five months due to diet and exercise, which is really exciting. And maybe the question, why is abdominal fat kind of the last to go? Why is that harder for us to kind of lose that part, that piece of when we're trying to lose weight?
Yes, it depends on the body constitution and genetics, and it is a key factor, the waist girth. But as long as, like Charles did an excellent job of losing the weight and trying to maintain that weight loss and having it in the context of whole lifestyle, like you were talking about, is very important. And so I think actually maintaining it and maintaining a nutritious diet and exercise are the key at that point. Yeah.
Great, thank you. So I'm not sure, Pauline, are you still on? So let me see, there's another question here. Are there any dietitians recommended in Reading that I would assume may deal with some of the nutrition education piece of it? There are some dietitians I know at Shasta Regional Medical Center, you can go to their website. I know they have classes there. Plus also there's classes and availability at Mercy Medical Center. And I think we're going to be sharing, if they didn't share already, some of the websites for some of the health education at both Mercy Medical Center in Reading. They have health education classes, and there's also Shasta Community Health Center has a lot of health education classes, and all of their classes are free. There's been some stall right now because of COVID, and a lot of them are trying to switch to some online format. But there's definitely a lot of nutrition education classes in addition to our prediabetes, our lifestyle change program that we have that's going on at the Y. There are others that you can be a part of, and some really good classes at both Shasta Community Health Center and Mercy Medical Center and Shasta Regional. So let me see. I think Carrie might have left. And I'm not sure, Pauline, are you still on? I wanted to ask her another question.
I am here. I am here.
So another question that I had, I'm not sure if Carrie's still on there. Do participants in the program often lose weight? I know weight loss is a key for, but it's not the only piece of a lifestyle change program, but it is a piece of lowering our risk for diabetes. So do participants lose weight in the program?
Yeah, that's a great question. So yes, I'd say most do, honestly, most do lose weight, but there are a few who do not. But that's not a failure. And I think that's the key thing to note, is that as a society, we gain weight every year. So sometimes just stopping weight gain is enough. And we've had participants that have just not necessarily lost a lot of weight, but they haven't gained any weight. And they have said that, up until this program, they've been gaining weight every year. So I think they're learning and they're changing. And I think even a lot of times just not gaining weight can be viewed as a success. Of course, we want to lose weight if we're in that overweight range, no doubt about it. But we really want to look and say, sometimes just not gaining weight, we should count as a success. And if we get that out of the program, we're happy too. But obviously the ultimate goal is to lose a little weight, but I never want to discourage people from feeling like just not gaining weight is not a success, because it is a success.
Thank you. And Dr. Kumar, I think you just answered a question about, can you share some early symptoms for type 2 that I should be concerned about? If you want to just share those that you wrote in the chat.
Yeah. So the important thing of diabetes is that there are no symptoms. It is hidden and invisible unless it becomes really uncontrolled. So that's the important thing. But if patients' sugars really go high and they're uncontrolled, they have increased thirst, increased urination. And sometimes we see patients who suddenly come with a blurring of vision. They never tested sugar and their sugars are really high. And sometimes they're always thirsty, they're always hungry. They're eating and losing sugar in the urine, and they also lose weight. So weight loss or weight gain can be present in different individuals. But the key symptoms when the sugars are really high are increased thirst, increased urination, weight loss or gain, and the majority of them don't have any symptoms until they develop complications, and those complications are hard to treat.
Right, thank you. Another question that came up is, ever since I developed diabetes, I'm having problems remembering things. Can diabetes affect a person's memory?
The diabetes that is uncontrolled in late stages can affect the vascular, like the arterial supply of the brain. The most important thing with diabetes is the link with the heart and vascular disease. So if they've been long and that is there, it definitely needs testing, but diabetes by itself, in majority of people, is not associated with memory impairment, and anybody who does have this concern about memory should get tested, simple tests, a physical examination by the doctor, and doing some imaging study or checking the vitamins like B12 and keeping the sugars under control.
Thank you. There was a question for Pauline. I think you answered it about if you're pre-diabetic but aren't overweight, can you join the program at the Y?
Yeah, that's that happens occasionally where we have somebody who's not technically overweight, but they do have the elevated A1C. And for our program, you do need a BMI of 25 or higher. Having said that, 25 is not a high BMI. You are not, obese at 25 BMI. So it'd be worth checking your weight and your BMI, ratio to see if you qualify. Because I was starting to type there that Barb, who gave the testimonial tonight, if you would have seen her when she walked into the program, I said, you don't need to lose weight. You look great. I mean, she looked fine, but her BMI was 25. And she had always struggled to lose those last, 5, 10 pounds, whatever it was that she needed. And her A1C was elevated. So she joined the program because she did have the BMI of 25. And she was able to lose those pounds and a little more and lower her A1C. So, we do have to have the BMI of 25. And correct, Dr. Kumar, you are correct. The BMI for Asians is lower at 23. So thank you for pointing that out. Yes.
Yeah. So I think I would, request that you consider that eligibility of BMI. In Asians, it is 23s.
Yes, and that is correct. They can enroll at 23. That is correct.
Yeah, and even in others, if they are of a pre-diabetic range, but they are not overweight, they
Right.
have a lot of room for improvement with your program.
Yes.
And I think the key interest is their willingness to come and part of it. So I would request that you take whoever is willing, if they meet at least one of the criteria, to
Right.
welcome them into the program and preventing them from getting overweight instead of making overweight an eligibility criteria.
Yeah, I agree with you. And that's something we can talk about more. I think the guidelines were set up by the CDC, not by the YMCA, but I agree with you. And honestly, I think most people meeting a BMI of 25 is not difficult, honestly. Sometimes even just having more muscle mass and less fat, you can be a BMI of 25 or higher. So it is something we work on a case-by-case basis. So I would encourage people who have an elevated A1C to come talk to us.
Good.
Thank you. Dr. Kumar, I think there's another question here that's really good. Is there any risk to having type 2 diabetes while pregnant? Maybe you can talk a little bit about gestational diabetes and what that is and how they may be at increased risk even after their pregnancy for diabetes.
Yeah, even very young mothers, they have diabetes called gestational diabetes in pregnancy. So that's why anybody who gets pregnant, when they go for antenatal checkups, they check their sugars and they continue to check them, because if their sugars are high, then there is a risk to the baby and the mother. So all pregnant women need to be checked and rigorously controlled regarding sugars to prevent any complications and having healthy babies. And anybody who developed gestational diabetes, their sugars can come back to normal after delivery, but they are at high risk for developing pre-diabetes and diabetes. So pregnancy, great importance should be given to checking for sugars and managing them very well. And anybody who has high sugars during pregnancy are a high risk group and they should be monitored. And some of the women who have high risk of diabetes are those with polycystic ovarian syndrome. So they all tie in together.
And I want to add to that, Dr. Kumar, that anybody who's had gestational diabetes is automatically qualified for our program.
Great. Yeah.
Great, thank you. We do have another question here about low blood sugar. A concern about, can low blood sugar cause someone to have hallucinations? Once the sugar is stabilized, hallucinations decrease rapidly.
Yeah, if low sugars are immediately problematic, whereas high sugars are problematic in the long run. So we have to avoid low sugars in all patients who take medications for diabetes, and elderly patients should not get medications that really cause low sugars. And especially if there are hallucinations on low sugars, they must be on medicines that do not cause those things. So that is what I was alluding to earlier about new medications. Now we have a number of medicines in our toolbox that we can use to prevent low sugars in elderly patients and still get good control.
Another question here that just came in. Someone I know died of a diabetic heart attack very suddenly a few weeks ago. Can you explain what that means?
You know, why that's a term that they are using, like diabetic heart attack. All diabetics are at high risk of heart attacks and strokes. So that is why now the American Diabetic Association has formed an alliance with American Heart Association. It's called nodiabetesbyheart.org. So they want all heart doctors also to play a key role in prescribing the right medications to prevent the heart disease. So anybody with long-standing diabetes, uncontrolled diabetes, they have risk of heart attacks, the risk of heart failure, and then so that is why I think they are talking about it. Patients with diabetes, if they have heart failure, the number of hospital admissions is twice that of those without diabetes. So diabetes is a great link for the heart disease. It increases heart disease. It makes them difficult to treat the heart disease. So that link is there. That's why we are stressing on pre-diabetes and good control of diabetes.
I think that's a really, good important point, that diabetes is a major risk factor for heart disease. And that's part of why we're trying to increase this awareness about the epidemic of prediabetes, because prediabetes is really a place where we can really make some lifestyle changes to prevent or delay diabetes and some of the complications of diabetes. Let's see.
Prediabetes is not diabetes, but they have a heightened risk for heart disease, even in the stage of prediabetes.
And that's a really important point too.
And correct me if I'm wrong, Dr. Kumar, but a heightened risk of stroke as well?
Yes, I'm making it simple to say one thing.
Yeah.
So they're all called MACE, M-A-C-E, Major Adverse Cardiovascular Events,
Okay.
which includes heart attack, stroke, peripheral arterial disease leading to amputations. So now in all our studies, we use the word MACE, which means it is all one vascular tree. It's either in the heart or in the brain or in the legs.
I think that's important for people to realize. I don't know that everybody thinks about that with diabetes. So I think that's an important point to make. So I appreciate you saying that.
So I think someone else is asking a question here that has a lower BMI of 21, but their A1C is elevated. And they're trying to say, I think that's a question, is there they're wondering if there's a type of program, maybe a lifestyle change program that they could go to. And I know that there's other, we definitely have the program at the the diabetes prevention program at the YMCA. And Pauline, you can let me know if your A1C is elevated, does that qualify you if your BMI is down, or does your BMI have to also be elevated if you have an elevated A1C?
Unfortunately for this program, the BMI does need to be elevated. And I believe the reason for that is the main goal of the program is weight loss. And so at a BMI of 21, weight loss is not their main goal. So I think this would be something to discuss with their physician. It doesn't mean that lifestyle changes wouldn't help them. Absolutely, it could. But in terms of our program and what the CDC has recommended and studied for our program, we do require the BMI of 25 and the A1C to be elevated. So that is, and I appreciate Dr. Kumar, I think he's right that lifestyle changes can still benefit this person, but I think they need to work with their physician to figure out what might be the best way for them and whether or not metformin might help them as well, that kind of thing. So yeah, I wish. This is one of the problems or one of the things that is frustrating, but the program for us does require the BMI.
And I, just to address that too, there are other, like I mentioned before, programs that don't have any qualifying pieces to it, like at Shasta Community Health Center, Mercy Medical Center, they have nutrition education programs. And at the end of this, I will share the Turn It Around Shasta .com website again, and all of those nutrition classes can find in our resources there. So that website is full of different resources for those that are pre-diabetic, for those that, for diabetics also, they can find some resources in there, and for medical professionals, there's some resources. So I think there are other lifestyle change classes that they could join and would help them make some of those healthy eating and lifestyle type changes to help lower that A1C.
Yeah. So yeah, one of the goals of that program is, weight loss, which plays a great role. But this is the kind of patients who really needs to follow with the physician, and he already is not overweight, so he needs to keep a close eye on his nutrition, exercise, and watch the sugars more closely.
So as we're approaching the hour of 7:30, we're coming to the end of our program in a couple of minutes. So I did kind of want to wrap up and see if there was any final comments from Dr. Kumar that you'd like to share with people that have been listening to this this evening. We'll start there, and then Pauline, if there's any last final comments that you'd like to share, and then I'll wrap us up for the evening.
Thank you very much for arranging this program and bringing, I hope this is the first of many efforts that you'll make and spread this message along. And thank you for all participation and some of the very thoughtful questions. And thanks for giving me this opportunity. Thank you.
Thank you. Thank you for being a part of this. It was really great to have you and have your expertise to share with us about this really important topic. Pauline, I didn't know if you had any final comments that you wanted to share. I don't think Carrie is on anymore. So if there's anything you want to share before I close us.
I would just, I would reiterate what Dr. Kumar said, and thank you for sharing, raising awareness. I think that's what I want to say. Thank you for raising awareness. And I really want to encourage everybody to check out the website and the resources that are available. I think the biggest thing we find from hearing from people at the YMCA when I talk to people is, I didn't know this was available. I didn't know I could do this. I didn't know I could go here. I didn't know this. And so I think just going to that website and hearing about what's available, educating yourself is probably the best resource for people. And so I appreciate working with public health and providing those resources for people, and I hope they'll use them.
Thank you. Thank you for being on here. I want to thank all the participants for being a part of this, asking so many really, really good, detailed questions. Dr. Kumar, again, for your expertise, and Pauline, It's so great to have the program at the YMCA that is available. And we do have other healthy eating and lifestyle change programs at Shasta Community Health Center and at Mercy Medical Center with some great, and Shasta Regional. So we have a lot of that available in our community. Our TurnItAroundShasta.com website, I put it into the chat there, just remembering TurnItAroundShasta.com. All of these resources are linked there, and information about classes and programs, about the WISE programs, more details and information there about that. So if anybody has more questions, go to that website. You can reach us through that website. Also, the YMCA Diabetes Prevention Program information is all on their website at sfymca.org. You'll be able to find information about the diabetes prevention program listed there. So I think now that we're at 7:31, we're going to be closing our program this evening. Again, thank you to everyone. The going virtual was an experience for all of us that participated and were a part of this. And we thank you, all the participants, everyone that participated in this. I want to thank all of our partners that are part of this, KIXE PBS, Shasta Community Health Center, Mercy Medical Center, Reading, the YMCA, Shasta County Health and Human Services, a part of this, Dr. Kumar, your time that you took, where we filmed our food demo. I really appreciate Karen, and then having Pam, the wonderful food demo that she did. I wish our plan was for everyone to try and be able to have what she prepared, but maybe we'll do this again and we'll be able to be in person and have it. But this has been an experience for all of us, and I appreciate everyone and all the roles everybody played in making this happen. Thank you, everyone, and have a good night.
Thank you. Thank you, Mary, for making it happen. Thank you.